you got this, you're gonna do it, you're gonna do amazing, and you're gonna be an amazing RBT, or if you're the BCBA getting it, you are gonna be amazing, you're gonna provide support for that RBT, and it's gonna be awesome. Alright guys, we got this. Hey, hello everybody, my name is Sarah, and I am a BCBA, and today we're gonna do an RBT competency assessment together. So, this video is gonna be good for those who are getting ready to do their RBT comp. We're gonna talk about kind of what to say, what we're looking for, the terms, you know, how a BCBA goes about doing it so you know what to expect. This video is also good for BCBAs who are going to be giving them, whether you're new or you just kind of want a refresher or kind of see how other BCBAs do it. I'm going to talk about my experience and what I've seen as far as what other BCBAs are doing and how I do it. So go ahead and like, comment, subscribe, all that fun stuff. Let me know what you think, and we're going to get right into it. Okay, so from my experience, there's a lot of anxiety around the RBT competency assessment because it's the first time those future RBTs are getting kind of examined and asked questions, and this is their first test. So they're incredibly nervous. You know, in BCBAs, we have our expectations and they know that. So I always try to go in with a mindset of it's okay. You're gonna pass, you're gonna do great. At the company that I work for, we give them up to 3 tries to pass. So if they don't pass that first time, I'll give them resources, I'll give them tips, some more training, things like that. I'll let them know, like, hey, if you don't pass, it's okay. We're gonna work on it together. I give them a heads up on when it's gonna happen. So I'm like, oh, hey, tomorrow at noon, we're gonna be doing your comp, okay? So that way they're prepared. And sometimes that helps, sometimes that makes it worse, but it's good for them to be able to start to practice those expectations and that communication. So I like to do that. And also, throughout this video, I'm going to be referring to the RBT comp assessment as the comp or RBT comp. It's all the same thing. I just call it the RBT comp because the other one's a big mouthful. So don't get confused on those. Yeah, so first we are going to talk about how it's going to be done and how your BCBA is going to go about doing it and the kind of ins and outs of that, and then we're going to get into the content of it. So there's 2 different kind of like competency assessments here. There's the initial and then there's the renewal. Make sure you're not doing the renewal. So how you know is the initial, you haven't taken your exam yet. This is the very first time you're doing your comp. You're not an RBT yet. You probably are going to be new to the field, or you're just new to that certification. A renewal is where every year you're an RBT, you're going to kind of get like a little quiz on making sure you've maintained the information. You don't take the exam again, you just do the comp. Your BCBA signs off on it and it gets sent off, and you're good for another year. The BCBA board, when they do this, they want you to be able to demonstrate a lot of it, role play it, or enter like interview style. So sitting down and me asking you questions is going to be really important. Making sure you can recall that information and apply it is what the BCBA is all about. And this can be done anytime, anywhere. Your BCBA typically is going to be the one that does it. There are a few other certifications that can do it, like the BCaBA can do it. Somebody that's in supervision training being supervised by a BCBA, feel free to ask who's doing it. They can tell you. But typically it's going to be your BCBA. Yeah, if we're like in a clinic or in a home, I could have you sit down, do interview style, and we could go through most of it just like that. Or some BCBAs like to do it like on the floor with clients, like working one-on-one and having you answer these questions while you're working and seeing you implement all of these things simultaneously. Some BCBAs like that, some do a combination. It all kind of depends on what they want to do. So a BCBA can get away with doing interview style for all of them except for the section skill acquisition and behavior reduction. At least 3 of those have to be with a client. So if you're sitting down and interviewing for most of it, that's okay, but there are some parts you have to be with the client for. For me personally, I prefer to sit down. So I know RBTs have our future RBTs have a lot of anxiety about this. So I like to sit down and just chat about it, because I feel like I can give them a little bit more information that's gonna be helpful for their exam as well. So like, if we're talking about a term and they're super close, but they just need this little thing, I like to have an opportunity to chat about it. And also I find that if I sit down with a future RBT, they're much more likely to ask questions, and I think that's important. They need to know that I'm here for them and that I'm available to answer their questions that they might have for the exam. Because, you know, we want you guys to pass. You know, that's our goal. So I like to take the combination approach of watching you do some of it with a client, implementing it, and then the other half sitting down and doing interview style. And sometimes I'll do both for some questions. It all depends on kind of your strengths and weaknesses and judge it that way. And then you're also usually going to do it with your company and the population you're going to be working with. So if you're going to be working with little ones or teenagers, those are typically who you're going to do your comp with. The exam's going to cover all the topics, and the RBT comps is pretty general. But since we're applying the information, it's going to be with the clients that you're going to be working with typically. There are some people that do it kind of on their own, get RBT comp and then go to a company, which I think is so interesting. So they might find their own client. I'm not sure how they find their own client. Maybe they use their own kids or, you know, a friend's kid or something and they do it on. Not sure, because like there will be people who hire RBTs or do RBT comps virtually, which I think is interesting. So if you've done that, let me know how that went. I'm curious. So another thing to know is if you fail the RBT comp the first time, you usually have more tries. The board doesn't have a limit on how many times you can keep trying to pass the comp. But it's all kind of up to your BCBA and how they want to do it. Typically, if you are really close to the answer but you just missed something important, I'll let you know and we'll try again later. If you're, you know, you need to study a few things, I'll usually give like a sticky note or be like, hey, these are things you need to cover, and then I'll do it the next day. It just kind of depends on your comfort level and where you're at. I always want to make sure there's enough chances in order for me to sign off on it, but I'm not signing off until I'm confident you are competent in this topic. Alright guys, so let's go ahead and get into it. So our first section is measurement. So as a BCBA from the measurement section, it's going to be mostly recalling information. So for continuous and discontinuous, I want you to be able to tell me kind of what those terms are, what terms fall under which categories. You're going to know that for the exam, so I want to make sure you know it now. And then can you apply it? So if I say, hey, can you go do a frequency count on little Johnny's head pinging? You're able to do that. For discontinuous measurement, can you tell me the difference between partial and whole? Are you able to kind of differentiate in those situations? So if I say, hey, today guys, we're doing a partial interval on little Johnny's crying, are you able to do that? Do you know what that means? Am I able to trust that? You can take that information and go. So those are some questions I would ask. And also like on continuous measurement, the big one that BCBAs like to ask is latency and IRT. So are you able to tell me what those are? Because the exam is going to want to trip you up on those. So I always like to ask and provide information and answer questions because those two are very confusing at times. A lot of potential RBTs do confuse those two. So I always like to kind of shake those out while I can. And then for data and graphs, we're going to want to know that you understand why we use them, why data is important, why you're taking data. So I'm looking for, it's observable, it's a way to measure behavior that takes out our biases. It's kind of a visual way to see how the learner's doing. Are they progressing? Are they not? We take data in order to have that information, and then we put it on the graphs. We can share it with our team, we can share it with parents, all that kind of stuff would work. So for our next section, we have assessments. Preference assessments and ABC data. So for this one, what I'm looking for, I'll usually have my potential RBT tell me two different types of preference assessments, and then I'll have them demonstrate some of the most popular ones, like a paired choice or a single choice / forced choice. And make sure they know what like a free operant is. We'll kind of talk about the different preference assessments and see if they have any questions. Multiple stimulus with replacement, without replacement is a big one that trips up a lot of people just because it's kind of complicated. So I just kind of talk about some tricks with that to remember it. And then for ABC data, I just make sure we know what the A stands for, the B stands for, and the C stands for. And I'll just kind of write out examples of how this looks. And I'll really emphasize that the behavior and the behavior column for ABC data is going to be the same. So we're looking at one behavior when we do ABC data typically. So let's say we're looking at little Johnny's nose picking because it's just become just an astronomical amount. He won't stop picking his nose. It's bleeding. It's a problem. We need to figure out what's going on. So typically I'll use ABC data when I can't figure out the function and I feel like I'm missing information. I'll have my RBTs do the ABC data to help me fill in those gaps. So I'll have you go out, do ABC data, and in that behavior column, it's always gonna be little Johnny's nose picking, antecedent, so what happened right before little Johnny picked his nose, and what happened right after is gonna be that consequence. So I'll have the RBT kind of practice filling that out and getting comfortable. So I think us being able to kind of talk through that and really understand how the ABC happens is essential to an RBT, and being able to react in those situations where a behavior just springs up on them. Can they handle it? Can they understand, okay, I did that thing and now little Johnny's doing this thing? I think it's a great learning opportunity. So I spend a lot of time on that one as well. Okay, so our next one is skill acquisition and behavior reduction. So this is a section where your BCBA has to see with the client at least 3 different skills. So they might just go out and watch if you're in clinic or in home and mark them off because they see you do them. They might see you do them and ask you questions while you're doing it and seeing if you know what you're doing or if you're just kind of regurgitating your training. But we got DTT, discrete trial teaching, and naturalistic teaching. Those are kind of the opposites of each other in a sense. So DTT and NET are the abbreviations for those. And I'll ask, do they know the difference? Can they see the difference? And a lot of times DTT will overlap with NET, but on the exam, they try to make it very clear. So the big thing with DTT is you're going to want to look at the very set up concrete learning situations. So it's not always at a table, but think of it as a structured learning that could be at a table. So you're sitting, you could be on the ground, you could be on the floor, you could be outside doing DTT, but typically you're gonna see cards involved because it's gonna be very controlled. You're gonna have your SD, you're going to have the behavior you want your learner to engage in, and then you're gonna have a pre-described consequence. So reinforcement or error correction. DTT is very structured in that way, whereas naturalistic teaching is going to be very go with the flow, child-led DTT, therapist-led. NET, child-led, they're kind of guiding us with their interests. We're using, their favorite colors or their favorite toys to teach them, that cars go vroom vroom, rather than having cards laid out on a table like we do at DTT style, asking which one goes vroom vroom. So can the future RBT can discriminate between those two things? Can they tell me what a DTT trial looks like and an NE trial? Can they show me what those look like? And know when it's appropriate is a big one. Like, why do we care which one a learner's doing? So like NET should absolutely be the primary intervention that we do with our little ones. DTT, I will typically start introducing more for those kiddos that are going to be going to school soon, that, are of school age, and but more structured learning, sitting in a chair, practicing those skills, preparing them for school is when we bring DTT in more. However, it all depends on the learner, it all depends on the BCBA, but that's kind of our typical guide on that. And then next we have chaining and shaping. So these ones I see future RBTs mix up all the time. So shaping and chaining, don't let them trip you up. They're similar, I get it, but let me help you kind of differentiate them here. So for chaining, you're going to be doing multiple behaviors, kind of chained, linked together in order to have an end result. So think about this. You're washing your hands, or you do your morning routine. Every morning you do it the same way. You don't even have to think to take your, your medicine or to brush your teeth, because you've chained behaviors together. So once you finish the last behavior, you automatically go to the next. So think about for washing hands. Once you put your hands under the water, you automatically go to scrubbing. Then you automatically go to get a soap, and you automatically scrub the soap in. That's because you learn these chains. So you have these specific series of events, and this is how we will teach learners. We'll use these specific series of events that make sense, that work together to teach them that chain and that kind of habit forming almost, to have an end result. Clean hands, morning routine finished, shirt on, teeth brushed. Like there's gonna be a final permanent product that you're gonna see at the end of a chain. So for shaping, the way I like to think about it is those tiny little behaviors that get us to one result. So there's gonna be one little thing reinforced after the other that's getting us to where we need to go. So let me give you an example. So we're teaching a kid to point. There's a lot that happens there in the movement of your body and the behavior that we can shape. So let's say our child has no ability to lift their hand and point because they haven't learned that skill yet. So we want to shape it. So first, let's say we reinforce this as if it's the greatest point ever because it's close to what we want, but not quite. So reinforce that. Once they've got this skill down, they can do this to what they want. Maybe we start by having them lift that finger up. Or maybe we have them put all their fingers out and then we slowly shape this over time where they put their fingers down. But they're able to do this and we reinforce this for, let's say a week, and then they master it. And then maybe we need that. Shaping is going to be a clap. It's going to be a point. It's going to be a sound. Whereas chaining is going to be something where you're putting those big behaviors together. So a clap, a point, touching your head is going to be chaining. So think about like head, shoulders, knees, and toes. So if we were shaping, we'd be shaping to teach the child how to touch their head. So maybe we reinforce this for, a week until they master it, and then this, and then this, and then, we move on to the next one. Whereas chaining, we would use that head, shoulders, knees, and toes would be the whole chain. This would be the shaping, just touching the head. The chain would be them chaining those behaviors together. That makes sense? Okay, and then also for chaining and shaping, I want them to be able to tell the differences between them, and I also want them to be able to tell me what the different types of chaining are. So do you know what forward is, backwards is, and total task? Are you able to do those? Those ones I want to see, because I use those a decent amount with my learners that work with younger kiddos. I use backwards chaining quite a bit, so I want to make sure you know how to do an entire backwards chaining procedure. And I can always do future trainings on that, but I want to make sure you understand the concept of it, and then we can fine tune the rest later. All right, so up next we've got discrimination training. So this is another one, it's big, it's fancy, but the answer is literally in the words, discrimination training. We're teaching our clients, our learners to discriminate. We're training them to discriminate. That's how I remember it. So discrimination training, example that I love is when you go into the bathroom. So you have a boys' bathroom, girls' bathroom. Let's say you go into the bathroom you're not intending to. So let's say I wanted to go into the women's restroom. I go into the male's restroom. I'm going to be uncomfortable. I'm not going to get reinforced. I'm probably not going to go in there and go pee because I just want to get out because I'm like, it's not what I expected. And then I run out. So I've learned over time that I need to go into the women's restroom in order to go pee on the toilet, get reinforced because I've been able to use the restroom, and then I leave. Whereas if I go in the men's, I don't get reinforced. So I'm learning to discriminate between the bathrooms based on my reinforcement history there. So it's the exact same thing with teaching our learners colors, sounds, friends versus not friends, strangers, all of that. So it's based on how we reinforce it and how we don't. Those SDs are going to be really important there. And then for stimulus controlled transfer procedure. So this one trips everybody up, which I don't blame them. It's hard. I don't really know why it's on the comp. I don't think it should be. But what you need to know for this one is understanding that our stimulus control is going to be transferred to the learner. So an example that I love is the stop sign. If you're driving, we want to learn that stop sign means stop. So maybe our parent that's teaching us to drive, our caregiver, friend, or whatever, is telling us, hey, that stop sign, you need to stop, put your foot on the brake, and over time, they're gonna fade their prompts back, and eventually, you're gonna be in the car by yourself, and you're gonna stop at that stop sign. Same thing for our learners. So, we're teaching them to feed themselves. We're gonna fade out those prompts, and one day they're gonna see that spoon, they're gonna be able to pick it up, and they're gonna be able to scoop and feed themselves. So you're gonna have a stimulus, and you're going to transfer our control to learn. Okay, up next, prompting. So prompting is a big one. For prompting, I'm looking to see if they can do the hierarchy up and down. So do you know the most to least prompting and the least to most? So I like to do this because it's very, very easy to mess up. It's very hard to go from each prompt, like climbing up and down that ladder and moving back and forth and being fluid with it. So I really spend some time on this one because we're going to be doing it so much with our learners typically. I'm moving away from prompting because it's not very, it doesn't promote autonomy. So I'm working on figuring out other ways to teach skills that don't involve physically moving our clients. But there are some situations where I am still using it. So for prompting, what we're going to want to do here for our future RBTs is seeing if they can reset those hierarchies and then making sure they can go out and do it and be fluid with it. So I will often have them do a new skill for their learner. So if we're teaching them the color red, can they go up and down that hierarchy, providing prompts as the learner is, losing motivation or is struggling to understand what we're teaching? Can they handle that situation? So that's gonna be the realistic situation that we're gonna see a lot. So this is one that I typically will mark off with a client. Token systems. So for this one, personally, I don't use them too much. I think there's better approaches, but I do use it sometimes. So I just want to make sure they understand what it is and that the thought behind it. Like, why would we use a token system? How is that process going to look? So like, I want them to know that I'm going to pair the tokens with reinforcement, and over time we're going to increase their endurance to get more tokens in order to exchange for a bigger prize. So a lot of times I'll try to use those more natural reinforcers like a recess that they might enjoy in school, things like that, or their favorite toys sometimes. So this one, I just want them to be able to kind of explain to me. If I'm going to use the token system, I'm going to go through and train my staff on it, so I'm not too worried about that one. And then our next one is crisis and emergency. For this one, I just want to make sure you know what to do if an emergency or crisis arises. And that's to get help, get your BCBA, find the nearest person, secure the space, make sure your client is safe. If your client's not safe, how do you get them safe? If there's a fire, what do you do? If there's a tornado, what do you do? Making sure you know your company's policies and procedures in that way. And making sure you know who to call or what to do if you're in home and there's a crisis or emergency is really important. Because the BCBA is typically not right there to help you, like they would be in a clinic. Okay, so our next one is you get to pick. So for this one, it's Antecedent Interventions, Differential Reinforcement, or Extinction. So for this one, it's up to you which one you want. Some BCBAs will have you do all of them anyway, but in order for us to mark it off and say you're competent, you pick one and you have to be able to tell us about it. So I am going to be BCBA that will go through and we will talk about all of them. I'll let you pick, and that's the one they'll mark off if you get it. But we're going to talk because they're all going to be on the exam anyway, so I want to make sure you know them. So we got Antecedent Interventions, Differential Reinforcement, which is the DRO, DRA, DRI, all that jazz. And then we got Extinction. So let's talk about them. Antecedent Intervention. So this one trips up a lot of people because it sounds fancy. So think about back that ABC data, ABC. So you have your behavior. So Johnny's like, obnoxious nose picking that's making his nose bleed and impeding his quality of life, okay? So he's picking his nose all the time. What happens right before that nose picking? Let's say his therapist shows up for services or for the session. So he starts picking his nose. So we know what that antecedent is. So as a BCBA, we're gonna look and we're gonna put an intervention in now. So our goal is always to do antecedent interventions and prevent the behavior from happening in the first place rather than consequence interventions. We don't always want to just give them consequences. So if we can avoid it, teach them to, escape appropriately or get attention appropriately, we're gonna wanna do that. So for little Johnny, let's say he picks his nose every time his therapist shows up, maybe it's attention or escape, right? So BCBA determines that, let's say in this case, it's for escape. He doesn't want to do work. He doesn't want to work with his therapist. So we're gonna put an intervention in. Maybe we teach him to say all done or break rather than picking his nose. So antecedent intervention, or maybe we give him a visual for escape, or maybe we have a chair out that he can sit down in rather than working, so that way he doesn't feel the need to pick his nose. Things like that. We're gonna put in these interventions before. A lot of times these are gonna be visuals, timers, verbal cues, things like that you'll see. And then differential reinforcement, so DRA, DRO, DRI. DRA is differential reinforcement of alternative behavior. So that's gonna be the example I just gave with little Johnny. So we're gonna give him an alternative behavior that's more appropriate. So a good classic example is, a kid that is shouting out in the classroom that wants the teacher's attention. We're gonna teach him to raise his hand or say, Miss Susie, rather than shouting. You're gonna teach him a more appropriate response, that alternative response. So for little Johnny, we're gonna be, having him sit in a chair, having him man to escape. So DRA is gonna be one that you should be using a ton. Teaching those more appropriate behaviors is going to be a big intervention to a lot of our challenging behaviors for our kiddos. And then we have DRI. So DRI is going to be those incompatible. So for little Johnny, let's say the BCBA decided instead of him picking his nose, they want him to clap his hands, because you can't pick your nose and clap your hands at the same time, right? There's other incompatible things. Let's say we have a kid who just does this all class. Obviously there's going to be other interventions we're going to want to put in and try, but maybe for them, they love sitting on their hands. So we have them sit on their hands, because you can't wave your hands in the air and sit in your hands at the same time. Those are incompatible. So a good way to tell the difference between DRI and DRA is that you are still having them do the behavior that they're still getting what they want in the DRA. So they still want attention, they're still getting attention. They want escape, they're still getting escape. So where it's DRI, it's kind of like canceling out that behavior. The idea is to end it, and they shouldn't be engaging in it anymore. It's gonna be your way to tell the difference. And then for DRO, so for me, when I do a DRO, it's gonna be more of a procedure, protocol, BIP kind of thing. So I'm gonna go way more in depth with it when I go to use it. So I don't expect the RBTs to know too much, just to understand the difference between DRA, DRA, and DRO. So for DRO, this one is going to be differential reinforcement of other behavior. So a good example, let's say we have a learner who just does this all class with jazz hands, So DRO, we are setting a 1 minute timer. If they don't do this in the 1 minute timer, they get a break outside the classroom, or they get their special toy, or whatever it is. So they can do anything else. This is where the DROs get tricky. So they could knock over a desk, they could throw a chair, they could, bite their hands, they could bite their peers, they could do anything. And that's still okay as long as they don't do this behavior. So we're reinforcing all other behaviors except this one. So typically when a BCBA uses a DRO, it's gonna be those more serious situations. So we need that client to not be doing this. So typically head banging, extreme, breaking skin, biting themselves. Again, there can be better other interventions. So usually DRO is gonna be like a package deal. So we're gonna try this, and a DRO. But for the RBT comp, what you're gonna wanna know about this one is just that is all other behaviors can occur except the one that we're targeting for an X amount of time, then we reinforce. If it does occur, we don't reinforce. Cool.
Okay guys, so fun fact, I forgot to record a section on extinction, so I am popping in here. I guess I was so excited about the differential reinforcement and got distracted. But anyway, I have on the screen here extinction, spontaneous recovery, and extinction burst. Those are the terms that we'll want to focus on in this section. So extinction, what it is just not reinforcing the previously reinforced behaviors. So to break that down for you, all it is if a kid is wanting attention inappropriately, we're not going to give them the attention. Or if you know, a kid is demanding something, like demanding a cookie, we're not going to give them that cookie. Because in the past, that child has learned that if I demand this cookie, my mom's going to give it to me. Or if I scream in her face, she's going to hand me her phone. Things like that. So all Extinction is kind of deciding that we're no longer going to reinforce that behavior. All right, so let me show you what this looks like on a graph. This graph that we have right here is for screaming. So when you see this graph, you see the baseline data. So we took 5 days of baseline data to kind of see our average concurrence of the behavior here. And then this will kind of tell us if our extinction procedure is working. So typically with the extinction procedure, you're going to see an increase in behaviors. And you might be wondering why. Why would the behaviors be increasing and that be good? So what the child has learned is if I scream in my mom's face, she'll give me her phone. We are going to teach them that that's not going to work anymore. And then we put that behavior on extinction by ignoring it, okay? So then we're ignoring it. They realize, okay, my screaming is not going to work. What do I need to do next? So they might start throwing, kicking, punching, doing a whole bunch of different behaviors to try to get that phone. And that's where differential reinforcement comes in. And that's kind of how these terms can overlap. When you're studying, you might notice that. So extinction is just that ignoring part, though. But anyway, so you can see at the red section, that's our extinction burst. So the behavior peaked, and then we see that green arrow takes us down. So that means the extinction procedure is working. And on here, I'm drawing what we would call a spontaneous recovery. So let's say a few days later, we're following our procedures, everything is still the same, and then suddenly the behavior just pops up out of nowhere. Little Johnny starts screaming in his mom's face again, even though just yesterday he wasn't doing it anymore. That's a spontaneous recovery. So spontaneously, the behavior just started happening again. As long as we're all following our procedures and we know what we're doing, it should just tip right back off and go back down to 0 again.
Okay, so for the last one, professionalism and requirements, I usually kind of fly through because at this point, you know whether they know their stuff or they don't. So we've got session notes, client dignity, professional boundaries, supervision requirements, and clinical direction. So session notes. Do you know how to do your session notes? A lot of you use soap notes. Do you know how to fill out stuff for insurance? Do you understand why we're doing it all? Do you understand you can't put your feelings in there? You can't put that Johnny had, a bad day because he doesn't like when the clouds are out, things like that. Yeah, keep it observable, measurable, all that fun stuff. Client dignity. Do you understand it? Do you understand how to maintain it? Give me some examples. Some examples would be, if your kid has a runny nose, a really dirty shirt, and they're playing with their friends, having them go change out a shirt. Making sure they're included and they're not, being bullied, things like that, like client dignity, making sure that you're maintaining their dignity. Just treating them how you want to be treated is usually a good rule of thumb. And then professional boundaries. So do you understand that you can't be friends with the families on Facebook or hang out with them outside of work? You can't babysit for them. They shouldn't know that your dog's name is Louie and that you love to do this, this, and that. Maintain that professional boundary. You are a therapist. You provide ABA and that's it. And then supervision requirements. So for the BCBA or RBT cert, you require 5% of your hours to be supervised by a BCBA. And then clinical direction. So for this one, we'll kind of talk about when to seek help. For me, it's always anytime you have any questions. If I put a program in and you're confused, seek help. If your client's doing a new behavior, seek help. If you are unsure how to track the data for an PIP, seek help. All that. So when in doubt, seek help is usually my rule of thumb. Your BCBA would fill out a paper, they would sign off on it, and they're going to send it off to the board to get approved. And then once it gets approved, that's when you can sit for your exam, you sign up through Pearson, all that fun stuff. If you don't pass, that's kind of up to your BCBA what you guys are going to do. Some might spend extra time with you working on it. If they just send you off on your way and tell you to try it again tomorrow or next week, that might be another approach. Whatever makes you feel supported and you can do it is, I hope, what they're doing. But yeah, if you guys have any questions, let me know. RBT comps are a blast. I enjoy doing them. It's a good way to kind of see who's committed to the job, who's studying, who's learning, who's excited. So I do look forward to them. Okay, So that's my video, guys. I hope this was helpful. I hope it's gonna help in your RBT comp. Just know that you got this. You're gonna do it. You're gonna do amazing, and you're gonna be an amazing RBT. Or if you're the BCBA getting it, you are gonna be amazing. You're gonna provide support for that RBT, and it's gonna be awesome. All right, guys, we got this. Have a great day.